This series of videos have been developed by Public Health Services. The sessions are designed to provide self-directed learning and cover the basics of infection prevention and control. This session is about healthcare-associated infections. From this session, you will have an understanding of healthcare-associated infections, patient risk factors, and how to prevent them from occurring. Healthcare-associated infections, known as HAIs, are the most common hospital complication, with an estimated 200,000 HAIs in Australian healthcare facilities each year. HAIs are potentially preventable adverse events rather than an unpredictable complication. HAIs lead to increased length of stay and hospital costs, as well as poorer patient outcomes. HAIs affect patients in hospitals or other healthcare facilities. HAIs are not present or incubating at the time of admission to the facility. They are acquired in the hospital and may appear up to 48 hours after discharge. HAIs are associated with poorer patient outcomes, increased length of stay, and healthcare costs. Therefore, prevention is an important patient safety initiative. The prevention and control of HAIs is the responsibility of all healthcare workers. There are a number of factors that make a patient more susceptible to acquiring an HAI. Immunosuppression and other severe underlying conditions will impact on the patient's ability to fight the infection. Patients who have high-risk procedures such as surgery, are prescribed antibiotics, or have invasive devices are at higher risk of acquiring an HAI. Poor infection control measures in a facility will also place a patient at higher risk of acquiring an HAI. An important element of HAI prevention is the appropriate use and implementation of standard and transmission-based precautions. These precautions prevent or reduce the likelihood of transmission of infectious agents from one person or place to another, and to render and maintain objects and areas as free as possible from infectious agents. Strategies include hand hygiene, the use of personal protective equipment, environmental cleaning, and reprocessing reusable equipment. Another HAI prevention strategy is minimising the use of invasive devices such as intravascular lines and indwelling catheters. This removes the portal of entry for opportunistic organisms. Antimicrobial stewardship programs assist in monitoring antimicrobial use in healthcare facilities and support the judicious prescribing of antimicrobials, thus helping to prevent the development of antimicrobial resistant pathogens. Surveillance programs monitor HAIs, detect outbreaks, monitor the incidence of multi-resistant organisms, and provide an indication of the success of prevention strategies. Urinary tract infections, or UTIs, are one of the most common healthcare-associated infections. Urinary catheters are frequently inserted unnecessarily, and insertion and maintenance practices vary. 70 to 80% of UTIs are catheter-associated urinary tract infections, or CAUTI. The main principles of CAUTI prevention are to limit urinary catheter use and minimise catheter duration. Other prevention practices are possible with insertion technique, maintenance, and quality improvement. When inserting a urinary catheter, prevention practices include clearly defining the indication, hand hygiene, selecting the smallest gauge catheter, use of lubricant, and a person trained and competent in the procedure. During maintenance of the catheter, CAUTI is minimised by maintaining a closed system, minimising catheter duration, maintaining unobstructed urine flow, regular meatal hygiene, and standard precautions during catheter manipulation. Quality improvement recommendations for CAUTI prevention include regular in-service training, clear documentation and protocols for catheter indications, reminders and stop orders, and surveillance on catheter use and any associated adverse events. Surgical site infections, or SSIs, occur at the site of an operation and are directly linked to the surgical procedure. Post-surgery infection is a common complication, but with varying severity and ramifications depending on the infection site and type. SSIs are classified as superficial or deep. Superficial infections involve the skin and the subcutaneous tissue of the incision, and deep infections involve deep soft tissues such as fascial and muscle layers, including the organ or space, manipulated during the procedure. Often the superficial infections do not require hospital readmission, but deep infections can have serious consequences and result in increased length of stay or readmission. Surgical site infection surveillance of significant volume and high ramification surgical procedures is important in detecting clusters of infection and allowing for investigation of potential causes of the infection cluster. SSI prevention principles are implemented during the 3 perioperative stages. Preoperative principles include patient antiseptic wash, hair removal as close to the time of incision as possible, incision site skin antisepsis, and antimicrobial prophylaxis. Intraoperative prevention strategies include the maintenance of a clean, positive pressure operating room environment, use of surgical attire such as sterile gloves, gowns and surgical masks, and maintaining an aseptic surgical field with an excellent surgical technique. Post-operative prevention strategies include wound care, good hygiene, adequate nutritional intake, and discharge information, ensuring patients are aware of signs and symptoms of infection. Bloodstream infections, or BSIs, are HAls that cause significant morbidity and mortality. In healthcare, they are often associated with intravascular devices that provide a portal of entry for opportunistic organisms. Patients with compromised immune systems receiving hemodialysis or are in intensive care units are most at risk. Therefore, prevention strategies are essential in minimising BSIs, particularly those that are central line associated, also known as CLABSI. The main principle to prevent CLABSI is limiting the use of intravascular lines and minimising line duration. Daily review of whether each central line is still required is essential. Other CLABSI prevention strategies can be grouped into insertion and maintenance practices. Insertion practices include hand hygiene prior to insertion, adherence to aseptic technique, use of personal protective equipment, the selection of an appropriate insertion site, and covering the insertion site with a transparent, semi-permeable dressing. Central line maintenance is important in CLABSI prevention. When handling the line, good hand hygiene practice is essential, and when accessing the line, use sterile equipment and aseptic technique. If dressings become wet, soiled, or unstuck, replace the dressing. Also, perform dressing changes at regular intervals according to local policy and using aseptic technique. HAIs are the most common hospital complication. The prevention of HAIs is everyone's responsibility, as they are a preventable event rather than an adverse outcome. This session has been based on the Australian guidelines for the prevention and control of infection in healthcare. Thank you to the Australian Commission on Safety and Quality in Healthcare for permission to use their standardised infection prevention and control science.